morning, Virginia. This is Virginia This Morning.
Acne is a condition that typically begins in puberty, and many of us outgrow it, but you can have acne at any age, and acne can leave scarring that can damage our skin and our confidence.
That's for sure. Local dermatologist and skin laser specialist Dr. Galen Fisher sees this quite often. He and his patient Marcia Muse share more about the benefits of laser acne treatments. Good morning and welcome, you two.
Good morning.
Yeah. You guys have been working together now for about 2 years.
Yes.
And tell us a little bit, excuse me as I get choked up about it, how you got started and kind of about the journey.
Well, it did start 2 years ago, but my journey really started much earlier than that. I started developing cystic acne when I was in my early 20s, really right out of college. And then it continued to get worse. I went through different courses of the drug Accutane. You probably have heard of that. And I did 4 courses, which is really unheard of. And it did help some, but the scarring damage was already done. So I went through microdermabrasion and some other procedures, and even had doctors tell me that there was nothing else they could do until I met Dr. Fisher. And he said, yes, I can help you. And I was like, oh gosh, all right, let's go ahead. Tell me what I need to do.
Yeah.
We've got some before pictures of the way your skin looked. And Dr. Fisher, explain to us what kind of acne causes pitting and problems on the face.
Typically, it's an inflammatory acne that's going to give you the most scarring. Cystic is the worst variant of that, so when you have a deeper cyst that becomes inflamed, the inflammation can lead to some breakdown in the collagen and lead to a pitted scar. So far, we've found that if we get to the scars early while they're still red, we can treat them very easily, and hopefully we'll have some before and afters of that. And in Marcia's case, we saw her a little later in life when the scars were more well formed. So we used laser, and we're still in the process. We'll continue down the road doing more to try and actually remodel the skin by removing tiny little dots of skin and letting it heal. And that's the way that Marcia's treatments have worked, is we take out a very small little dot of skin, all over the face little dots, and let it heal. And it remodels, and the scars become gradually softer and softer.
Marcia, what does this feel like? Is it uncomfortable? What's the healing time?
It is uncomfortable. I won't say that it's a walk in the park. It is uncomfortable, but you are numbed prior to the procedure, and the healing time is about a week, although this last procedure, I just think that my skin continues to get healthier and healthier, and it was an easier heal. So I was out and about by Thursday after the procedure was on Friday before, and really even went out on Wednesday afternoon. So there is a healing time though, so you have to be prepared for that downtime, but you know, it can be probably for some maybe more than a week. For me, it was under a week.
And doctor, we're talking about scarring that topical treatments can't fix.
That's true, yes. So topicals can do something to make a skin a little more, have a better glow, a little brighter, but they're not actually going to change the underneath skin in a way that will result in improvement of most scars. We've found that laser really seems to be the best way to improve scars. As you can see on the before and after, those scars were younger scars in a younger patient, and they went after about 3 treatments very nicely. Dramatic improvements.
Significant, yeah.
Yeah.
And Marcia, we talk about improving confidence with these treatments. How has your attitude changed now that you're getting these treatments done?
Well, that was something I always had to fight, because you are very conscious, I think, even whether male or female, but especially as female, very conscious of the way your skin looks. And I can remember when I started my career in education and I was teaching, that students would look at me and say, you know, why do you have so many holes in your face? And it was really hurtful, even though they were very innocently asking me that question. So it did take a knock at my self-confidence, but it truly has helped now that with this procedure. In fact, I was sharing with Dr. Fisher that now I'm an independent Mary Kay beauty consultant, so I truly have the confidence level to help others and have others look at my skin, and I tell them some recommendations for their skin as well.
So doctor, this can be both physical and psychological.
Yes.
Most definitely. We see that transformation in a lot of our patients, and it's wonderful, especially children heading off to college. They don't want to show up at college and be viewed differently because they have a lot of acne scars. And typically those patients have more inflammatory scars early stage, and just a few treatments we can make a dramatic improvement. So it's kind of neat. It's very satisfying as a physician to be able to help people with some problems that previously weren't very easily approached.
Exactly.
Absolutely.
Awesome.
We've seen the before, and now we've enjoyed the after, and you look great. Thank you, Marcia.
so much.
Thank you,
Dr.
Dr.
Galen Fisher and Marcia Muse. Thanks so much for joining us today and sharing your stories.
Thank you for having us.
You're very
Appreciate it.
welcome.